welcome to the 2025 North Carolina Institute of Medicine Annual Meeting. It is especially meaningful to us that you are here today to take part in discussions on an incredibly important topic for our state, Healthy North Carolina 2030, and where we stand as we work to meet the goals laid out in our State Health Improvement Plan.
I try to come to the NCIOM Annual Meeting every year. I find it to be one of the places where I get to see important people with whom I work. I get to network with them, I get to learn from them, and fundamentally, I get to learn from the wonderful programming that happens at this meeting. Every year, there's a deep dive into something that I have historically cared a lot about. And being able to hear from leading experts in our state and across the country provides incredible education and is very valuable to me.
Public health and healthcare sometimes get separated. You talk about those silos. Hospitals here, the health departments here. They don't play nice together always. What are some promising ways that we can bridge that together so that we can look at populations like whether you're as big as North Carolina or talking about Burke County, where I'm responsible?
I was not joking when I said nurses are so powerful. They're so amazing. They're the ones who really are the backbone of the healthcare system. And they're also leaders who know what's happening with their patients. And those patients are individuals. Those individuals are part of the community members who we're trying to elevate. So all of it is interconnected.
In the Division of Public Health, health and well-being is what we're all about. That's our core mission. And so for us to have the opportunity to sponsor the NCIOM's annual meeting, especially this year, when we're focusing on the midpoint of Healthy North Carolina 2030, was really important. 80% of the health of our state and of the country is based off of things that are non-medical in nature, things like housing, things like access to healthy food. And so for us to come together at this moment in time where there's a lot of uncertainty, it's really important to be together around things that we are certain about.
Being a partner with NCIOM has been meaningful and purpose-driven. From being a presenter to a facilitator for the North Carolina Opioid Research Convening, those partnerships have also driven meaningful conversations and sustainable impact for communities across our state.
Leveraging our partnership between AHEC, IOM, and SHEPS, we're able to build on the best of our organizations by bringing people together, leveraging data, and then catalyzing action at the local level to take on some of these long-standing thorny problems, and we're beginning to see a difference.
I have had a chance to partner with NCIOM in a number of different capacities. I was formerly director for the Division of Mental Health for the state and interacted with the Institute of Medicine in that capacity. And now working squarely in the mental health field and suicide prevention. I find a lot of the resources that NCIOM produces, a lot of the information around like the Healthy North Carolina 2030, even the mental health space is something I find very beneficial.
My name's Ashley Jarrett. I'm the Assistant Health Director at Burke County Public Health and an adjunct professor at UNC Gillings School of Global Public Health. What brought me here was that I was recently onboarded as a new member of NCIOM, and this is my first annual meeting. I would identify NCIOM as a strategic, evidence-based, locally grown communications agency.
If I could describe NCIOM in one word, it would be thoughtful. And one thing that I really value in that thoughtfulness that I'm raising is that expertise comes from everywhere. It can be your lived experience, it can be your perspective. And we need all of those perspectives to come together when we are making decisions as a state.
One word or phrase is hard, but I would say essential. And I would say essential because there are so many people in our state that do so many wonderful things, but the IOM pulls people together to focus on areas of common interest so that we can come up with solutions and approaches to respond to those areas of common need. Without the IOM and its essential role, that collaboration, that convening, and those hard conversations and solution gathering would not occur.